So I first want to thank all of you for coming today. I see a lot of our students, which is really exciting, and we have a very distinguished panel of alums, all of the school. And I can't claim 3 of them because they were here before I was, but at least 2 of whom were students in our program, and I've gotten to see them, come from students and go through several different now jobs and work in the field of food law. So just, to give you some sense, I think many of you are here, I think, for lots of different reasons, and I'm going to actually ask you a few questions in a minute to see who's in the room. But just when you think about what brings us here, if you think about soda taxes, which have been in the news a lot lately because of litigation, because of, in Cook County, a soda tax passing and then a couple months later being repealed for political reasons, sodium warnings and sugar-sweetened beverage warnings and litigation over both of those. Discussions over lab-made meat and cultured meat, and then also over genetically engineered products and what those mean, the regulatory process for producing them and getting them to market, and then labeling questions over how you will tell consumers what they're buying and consuming. Budget debates over lots of things, but recently also over SNAP, which is the Supplemental Nutrition Assistance Program, or food stamps. So these are just a handful. I could keep going. I think often the first day of class, I'll put together a list of just things that have happened in the past 2 weeks in the news that are food-related, that relate to topics that we talk about. And it's really present in people's minds. I think there's been, recent years have seen a lot of increase in concern and attention to issues related to food and how they impact health and the environment, how they impact transparency and purchasing decisions, and what consumers really want to know. So today we'll talk about some of the big questions around why you should care about food, why we care about food, what is food law, why food law and policy, or food law. We are kind of all coming at this from really different perspectives, as I know some of you in the audience who I've had the pleasure to get to know. So how are we kind of coming at this from a lot of different ways, and what does that mean? And then also, where's this field headed? What are some of the big questions that we're grappling with? So you're going to get to hear from some exceptional alums. We're going to have a conversation, and there will be time for all of you to ask questions as well, so get ready for that. So let me just start by introducing the panelists. So to my left, we have Ona Balkus, who is an alum, was in the Food Law and Policy Clinic, and then was a fellow in the clinic for 3 years until just about a year and a half ago, and then left us to become legislative counsel for D.C. Councilwoman or D.C. Council member Mary Che, where she's writing legislation on a bunch of issues, including food-related issues and environmental issues. And next to her is Barton Hutt, who is the father of food and drug law, which is one of the fields from which this broader set of food law and policy questions and issues emerges. So the difference really being food and drug law is really the study of what the Food and Drug Administration does and can do and should do. And I think what we're realizing, certainly in my work and many of the others here, is that that's really important. We need safe food that's labeled accurately, but there are lots of other questions and issues coming up that really are beyond the bounds of FDA law. And FDA law also concerns itself with drugs and medical devices, which have taken more and more, actually, of the FDA's resources. So Peter also has been teaching food and drug law here at Harvard Law School for 24 years. It'll be his 25th year this winter. We'll have a party.
Anybody who wants to come, just let me know.
And he was chief counsel at the FDA from 1971 to 1975, which is where he draws a lot of his expertise, and author of the main FDA law casebook, and now is counsel at Covington and Burling, senior counsel at Covington and Burling. And then next to him is Smita Narula, who is currently interim director of the Human Rights Program at the Roosevelt House Public Policy Institute at Hunter College. There's a lot of words in that title. But Smita actually comes at food from a human rights background. So she was previously a clinical faculty member at New York University in human rights, but was doing a lot of work on the right to food, and sort of still actually about to teach a new course on issues at the intersection of food and human rights. So we'll get to hear about that. Next to her is Nate Rosenberg, who is now a scholar and consultant on issues of food and the environment. So he was last year visiting assistant professor at University of Arkansas in their food and agriculture LLM program, and is still teaching their adjunct, and is consulting with both Earth Justice and the Natural Resources Defense Council. Previously worked at the Natural Resources Defense Council, and also was a Mississippi Delta Fellow. So those who know the Mississippi Delta Project, he was the fellow there before that. And then as a student here, was actually started Harvard's Food Law Society. So I know we have at least two of our Food Law Society leadership here today. So Harvard was the first Food Law Society, so we can call Nate the father of Food Law Societies. And then everyone's going to be a parent today. And then next to Nate at the end is Tama Matsuoka Wong, who is a recovering lawyer. So practiced corporate law for many years. But actually is here today because she in her career change now is a professional forager and author of cookbooks on foraged foods, so the names of which are Meadows and More, and then, the business is Meadows and More. Her books are Forage Flavor and Scraps, Wilts, and Weeds, which also has a food waste focus to it, which is great. So we have a really, as you can hear, it was on purpose. We wanted to show you the diversity of what people are doing and how people are approaching often some of the same core issues around what we want our food system to do and what it's not doing and why that's problematic, but from very different backgrounds and interest areas. So the other thing I want to do, actually, before I want to tell you just briefly about our clinic here, which is what I direct. Because I'm guessing that many of you were not here when we had a food law and policy clinic, probably mostly except for the current students. So let me tell you that, and then I want to ask a little bit about who you are before we start our conversation. So just for those who don't know about the Food Law and Policy Clinic, we've been around for about, almost 7 years. And the idea behind this clinic is really to move the dial on some of these big food questions and food law and policy issues while educating students about how to work in this space, about the substance of laws that regulate the food system, but also about how to do the work of community building, community organizing, policy advocacy. So as examples of that, we try to influence policy dialogues by developing new ideas. So this week we've been talking with students about brainstorming new ideas. That's something we have the luxury and time to do. Some of these problems are old problems, but it's just people haven't taken the time to sit down and think about, for some of them, what can we do better? What are the options? What are the possibilities? So for example, we put out a paper earlier this year about the U.S. Farm Bill, which is one of our biggest pieces of legislation that supports our food and agriculture system. But there's about $500 billion allocated in the Farm Bill every 5 years, and not a dollar of that has been spent on making sure that all that food that we produce and get out to market actually makes it to tables instead of getting thrown away. So that was really, putting out ideas, thinking about what's possible, talking to different stakeholders and to policymakers. So that's an example. We also help draft bills and pass legislation. So students have gotten to write pieces of legislation. They've gotten to write fact sheets and op-eds and press releases around why this legislation is important. So as an example, 2 of the bills that we wrote in California were signed into law within the past 2 weeks. One, trying to standardize the date labels on food packages, and then the other one offering additional protection for those who donate food that's excess food. So students got to work on every step of that. We've had students out testifying. So we actually had a student testifying earlier this year in the DC Council for legislation that Ona wrote, which was pretty cool for us too. So students are getting kind of their hands dirty doing that policy work. And then we do community organizing. We have students have worked with a lot of community coalitions or food policy councils to try to help them take the challenges that they see on the ground and conceptualize what change could look like. So sometimes it's bringing ideas from other states. Sometimes it's helping figure out, which level of government can work on this issue? Is something you thought the federal government was doing, but really you can address this closer to home? So we've done work along those lines everywhere from Mississippi to West Virginia. We have had an ongoing project in Navajo Nation. And I'd say the last thing we do is we do work trying to build the field of food law and policy. And so I'll kind of come back to that later, what that looks like. But we are Harvard has the first clinic, as we are the first for so many things here at Harvard Law School. We are the first food law and policy clinic. We're now one of 4 dedicated food law and policy clinics in the country, and many others are doing more and more work in this space. So a lot of our work has also been documenting that and trying to build space for collegiality, for people coming together and talking about what this means. And I'd say this panel is one of those things, bringing people together and explaining to others why this is a field, why it's important. So before we get to our panel, we all talked and we thought we wanted to know a little bit about you. So I guess I'll start by asking who here works on food issues, on food in any way? You can raise them higher, even if you work in our program. Students who have been in the clinic, you should raise your hands too. All right, there you go, okay. And who works on other issues, but where food has come up? You've done some litigation, something happened to be food related, or it's your environmental law, but some things are related to agriculture. Okay, a couple. Who's been affected by food laws in their life?
Everybody.
But some people didn't raise their hand. Who eats? So I think, as you can see, it's good for us to know a lot of people are kind of working in this space. But I think also these laws are, like so many others, they really impact us every day, 3 times a day, because there's a lot that law does to encourage people to produce the things that wind up on our plates that might, in some ways, discourage new things or make it challenging for new things to come to market. So I think to start, I want to ask Peter, actually, to get us started, because he has been doing this the longest, so kind of has a sense of the history of the field. So I guess, Peter, if you can just tell a little bit, where do you think this field came from? What are the roots? What have you seen from your vantage point?
There was never a time in recorded human history when there were not laws relating to the food supply. Food law is the oldest recorded form of government regulation of private enterprise. If you go back to the first law code, the Code of Hammurabi, about 5,000 years ago, you'll find a provision, in fact, more than one provision, relating to the regulation of food. So it's obvious why. They had terrible concerns back then about getting enough food and about accurate representation about food. My 2 favorite statutes, for example, in medieval England, was one that literally said it would be a crime to adulterate, which was the word used, the food by adding anything, quote, not wholesome for man's body, quote. If you take a look at our modern food safety law, there's no improvement. You could regulate the whole food supply using the 1266 statute. And at the same time they were doing that, they required bakers to write their name in a loaf of bread so the consumers would be able to tell where the bread came from in case there was a problem. And in case you think there weren't any problems, this is no joke. They used to put all kinds of white material with the flour in there. They even put pebbles in the bread. I never understood that one. Well, those laws came over with our colonial settlers in the United States. And after the Revolution, the first place you find them are at the city level, then in the county, then in the state, but not at the federal level. And the reason not at the federal level was because of the very narrow construction of the Supreme Court about the Commerce Clause. There was no room for federal regulation at that time until a socialist wrote a great book, The Jungle, and convinced the country not to become socialist, but that there was a problem with the regulation of meat. And therefore, the first federal statute was 1906 in our country. It took 27 years to get that through Congress. Then that was modernized in 1938 and continues up to this day. I'll conclude these brief remarks simply by saying 3 new statutes in the last 5 years dealing with the food supply. The first, menu labeling of nutrition information. The second one being genetically modified food being labeled, which USDA is trying to figure out how to implement right at this moment. Both those were on the labeling side. On the safety side, a major, major statute, the Food Safety Modernization Act. So this is a continuous process. The law gets revised and amended and added to all the time.
So
how's that for 5,000 years?
I think you skipped a few things, actually. I was a little disappointed now. So I think it's interesting, actually, that you got to some of the things you got to. For example, the GE disclosure law, which actually requires USDA, gives that power to USDA rather than FDA to come up with the actual regulations implementing this disclosure. And I think it's an example of one of the things that we've seen in the food system, which is for so long, I think everyone really thought the Food and Drug Administration would handle all of these issues. And there's actually quite a big regulatory fragmentation. So I don't know if you want to comment also on any other agencies or what that looks like. And then I think it's also why we've brought all these other voices to the table, too, that are dealing with food maybe outside of the FDA.
Well, one of the great debates on food law for the last 50 years has been, should you take all of the different elements of the federal government that impinge on the regulation of food and put them in one agency? For example, meat and poultry are at USDA. The whole rest of the food supply is regulated by FDA, except that the pesticide residue levels in food are set by EPA, and they are enforced by FDA. So you have this system, and I always point out, why does this exist? History. If you don't understand the history of how these things develop, you'll never understand why they are the way they are. In 1882, USDA decided to separate the Bureau of Chemistry, which is now FDA and was in USDA, from the Bureau of Animal Industry. That explains why meat and poultry are still at USDA, just as one example. But there are about 15 agencies, separate fish agencies, etc., that the Bureau of Alcohol, for example, alcoholic beverages are food under our law, and that's regulated by a separate group. If you put them all together, my own view is you'd have bigger chaos than you have today, but that's just one person's viewpoint.
Thank you. Maybe we'll come back to that and we can debate on that later. So I want to actually ask Ona, and then, just as one other perspective. So I think I didn't really mention this, but as a student, Ona did a JD and also an MPH, and so really, I think came to this originally with a health interest as well. So I think one area that we could argue about which pieces of this FDA does well is around the impacts that the food system has on public health, notably on diet-related disease. So I don't know if you want to talk about your interest, how you came to this, and some of the issues that you particularly that are coming up in this space?
Sure. Yeah, so as Emily said, I got a joint degree here at Harvard, and I originally got interested in food because I was teaching cooking-based nutrition classes as part of an AmeriCorps program, and I like to say I got productively angry. It was so frustrating to teach people that wanted to change their diet about healthy eating when there were so many environmental factors in their lives and in their neighborhoods that made it very difficult to eat healthy. And I think one of the most exciting things watching food law and the clinic grow over the last 7 years has been seeing people make the connection more between the environments that people are living in and eating in and how that impacts their health. And you really see state and local governments, which I have more experience with, so I'll probably focus on that more, and the federal government addressing those issues in two separate ways. The first is, before people get sick, how can we change environments to encourage and incentivize healthier lifestyles? So there's a big debate on the federal level about, should we be incentivizing the agriculture of healthier foods, so of fruits and vegetables, specialty crops, rather than the current system, which leads to cheap commodity crops like corn and soy, and eventually in the grocery store, products made of those crops being cheaper, more accessible. Should we change the way we incentivize agriculture in this country? And then on the local level, there's a lot of great programs. In DC, we have a program called Produce Plus, where low-income residents get a voucher for farmers markets. So if they go to the farmers market and spend $10, they get an extra $10, so they can spend $20 at the farmers market. That's just one example. And then the second way that you see this connection happening is after people are sick. What can the government do to use food as a way to address those people's illnesses and hopefully decrease the amount of time they're sick and increase their quality of life? So, for example, there's a program that's been happening in different states and cities around the country called the Fruit and Vegetable Prescription Program, where people who have chronic illnesses actually get a prescription for buying healthy food to cook for themselves. Or even there's a program here in Boston and also in DC where medically tailored meals for people with HIV and cancer can actually be paid by their health insurance. So the same way your health insurance subsidizes your drugs, it could subsidize foods you could eat that make you feel better. So we're seeing it more and more. It's a hot topic because both federally and locally, we are spending a lot of healthcare dollars on diet-related chronic disease. I think this will just keep growing, and it's exciting.
Great. And I'm going to go down to the end and have Tama actually talk a little bit, bring in a little bit the environmental side from your vantage point,
Okay.
having a perspective in this. And then also, I think just because you are kind of have taken a turn in your career where you're working on food, not necessarily as a lawyer, but how, how's your career evolved?
Sure. So I have a startup wild food business, and a lot of how I came to this was I was overseas for a long time, but I came back to the New Jersey, and I was working with a lot of conservation groups. And besides the fact that more and more of our potentially fertile land is being degraded for agriculture, and there's less and less, they think there's less and less, and we're running out of that. Besides that, one of the major issues and challenges for property managers and conservation groups is there's too many invasive species. Invasive species are usually species that have come, they have no pests and other types of mechanisms here, and so they're actually becoming like monocultures across a lot of our landscapes and are causing a lot of havoc to the environment. And so the government spends billions of dollars and trying to get rid of this, and there aren't enough people. There are just not enough people to volunteer to get rid of these. Some of these invasive species, which I was trying to get rid of, when I looked into a little more, being, having a lawyer's investigative mind and being able to, not being afraid of Latin, I found out that these plants are plants that come from other countries, like Asia. And they're actually gourmet delicacies. So a lot of the stuff is around us. So, a light bulb goes off, you can use some of these invasive species help the environment. At the same time, it's an amazing food source. Now, of course, the idea is easy, and so a lot of what our business is doing is actually making that actually execute that and taking something and being able to sell it to Michelin-starred chefs is a challenge, but it's very exciting, very creative, and there's always something more to do.
So as a follow-up, I think it brings up also that there's been a lot of change over, I'd say, the past few decades in what people want to eat, what people want to grow and sell and produce. And so this is just one example where we're getting rid of one plant and now realizing actually there might be another use for it. I think we see this also in the context with laws in a lot of cities now to allow urban agriculture, growing food, keeping chickens, which Ona could talk about keeping chickens in D.C. But I think a big change is in what is food, what do we eat, what's edible, where does it come from, is it right in my backyard perhaps? But I actually wanted to ask as a follow-up to you just a question, because there's another way in which what you do can kind of interact with law, which is laws around not allowing people to harvest or take certain crops, even weeds, from parks. So I don't know if you want to say a little bit about that as well.
So obviously it's something sort of new and cool and trendy. So you have a lot of people jumping into here who have no legal background. They don't really know species, and they don't really know about the land or the terroir. So it's illegal in a lot of states to do this. But it would be pretty easy. In the West Coast, it's actually a mechanism in place for mushrooms. It's a pretty big industry there. So you just look at it under Fish and Game. So you have to pay for a permit. The permit goes to the land manager or the park ranger, so income comes in. And then they're only allowed to take away a certain amount, which is specified during a certain season. And if there are certain parks that become over-harvested, you can no longer go to that park for the season. So that would be something which you would probably have to have some kind of, I think you have to, certify if you want to be able to, hunt game, you have to have a license. And then you would have to be, the payment would go into helping to maintain and steward those lands. So there is a mechanism, but it hasn't been extended to much beyond, fish and game and some mushrooms.
Yeah, I think it will be really interesting actually to see. There's been some debates actually in New York City as well as other places around people foraging things from parks and what are you allowed. And even here in Boston, you can do like an urban foraging tour, which if I could wake up early enough on a Saturday morning, I would do. So let's actually turn to Nate next to talk a little bit about, I think one thing that we talk about health or the environment or even safety. A lot of these things, there's sort of distributional impacts on how the food system impacts certain populations and the disparities in that, both in terms of who is benefiting from the food system. I mean, who's making money, who's producing things, who's who has farms and land, and then also in terms of who's suffering from some of the harms of the food system that are environmental or health related. So I would love to hear you kind of talk about your own work in this space and what we're seeing primarily domestically, and then just as a foreshadow that we'll go global after that with Smita.
Sure. Yeah. So, I mean, what we see here in the United States is that our food system is very much like other parts of our economy, but only more so. And so I was talking to a farmer recently who I think summed it up well when she was talking about the barriers that young farmers, specifically she trains farmers of color who want to go out and start their own farms. And she was talking about the barriers they face, and she said, wealth makes wealth. Pretty much just their wealth inequality is probably the biggest barrier, according to her, for these young farmers. They're highly motivated. They come into her program often having a lot of knowledge, but farming and getting the necessary land is expensive. And in the food system, you not only have wealth inequality, which is an issue in all areas of our economy, but that's compounded by the fact that a lot of the wage and labor protections that workers in other areas of our society have, we don't have with the food system. And a lot of that has to do with the fact that when these wage and labor protections were put into place, Southern legislatures had a huge amount of control in Congress and set the legislative agenda to some degree. And if you think about who the labor force, particularly in the food economy in the South, was at that time. It was black laborers, and so they did not receive the protections that other workers did, and we're still dealing with that not only in the South but in places like Boston, in the food service industry with agricultural labor. So there's a lot of work to do when it comes to inequality.
I'll say. So taking it a little bit kind of to the global level, where does all this stuff that we're talking about kind of fit in? I mean, how is the U.S. impacting others, or how are we kind of grappling with similar issues and movements going on elsewhere?
Sure. I'll actually just begin by saying my thanks to you, Emily, for bringing us all together and for being a pioneer in this field that I think is just really poised to grow, and really is a space where many can come who are interested not just in safety, environment, public health, but from my vantage point as well, who are also really interested in food as a mechanism for delivering and examining power, and food as a means of organizing society to ensure greater racial, gender, economic, and social justice, including justice for indigenous peoples. So food to me is a really exciting area to do that. I'm really regretting not taking your course now, Peter, and really. But I have a reason, and the reason is because when I was in law school, I wasn't at that point 20 years ago thinking about food in those terms. I was doing human rights work. I went on to work at Human Rights Watch and then teaching the Human Rights Clinic as a clinical professor at NYU Law School before coming to Hunter. And so I come to this work through the lens of human rights and through the idea of how is it that we can go about ensuring the right to food for all. And if I can answer that question just by sharing what the right is. So the right to food under international human rights law is the right of all people to be free from hunger, but to also have physical and economic access at all times to sufficient, nutritious food that is culturally acceptable and sustainably produced, so that the right is also preserved for future generations. So if you just take that one right, which has been really radicalized and made robust by social movements all over the world, and think about, well, how do our food systems measure up to ensuring that right? Well, measured against the requirement that we should be ensuring sustainable and equitable access to nutritious food for all in a sustainable way, the food systems that we've inherited from the 20th century have failed spectacularly at a global level. Nearly 1 billion people in the world suffer from hunger and mal or undernourishment today. An overwhelming majority live in the global south, but right here in the United States, 1 in 7 people live in a household that's considered food insecure. And here, of course, the calorie-rich but calorie-rich but nutrient-poor foods have also led to an epidemic of obesity and other public health crises. And then you have industrial agricultural production that has caused immense environmental harms globally by adding to greenhouse gas emissions, by extending monocultures, destroying agrobiodiversity, and accelerating soil erosion. So that food system has not only failed on all these other levels, but also has made it so that the food that comes to our plate arrives at us through an enormous amount of violence to the people who produce it and to the planet and the ecosystems where we produce our food. So globally, what is happening then? So globally, you're also seeing a lot of movements that are standing up using the language of the right to food, the language of food sovereignty or food justice, to demand a shifting of power in the food system. And I think that's where a lot of the interesting conversations globally are happening and connecting to the United States. And just to give one statistic to give some sharp relief to the idea of imbalance of power, we have a handful of agribusiness corporations that are controlling the retailing, processing, production, marketing, and distribution of food. On the one hand, that's just a few agribusinesses control that. And on the other hand, the majority of people who are food insecure and hungry today, most of them women and people of color, are somehow involved in the production, processing, or selling of our food. So the fact that those who are producing our food and feeding us and are the ones who are the most food insecure, for me, makes this a rights issue. It makes it a power issue, and it connects very deeply to what is happening in movements in the United States, because because how we set the food system here and how we hold particular actors accountable and how we organize our consumption choices under a globalized economy has enormous impact on rights around the world.
So as a follow-up, and I know this is sort of a pervasive question in human rights, but just how does it work using that same language domestically? Do you see it as being helpful or a hindrance to, even if the attempt is somewhat aligned with what other groups are trying to do? What do you think about that piece?
Using the language of rights here. It's actually a really exciting moment for this language, and I've been fortunate enough to be involved with a lot of other movements and actors here that are trying to use the language of food sovereignty, food justice, or the right to food, which all have distinct meanings, but to change the narrative around the conversation. There are two really dominant narratives at play, both in the United States and globally, in terms of how we deal with food crises and food issues. One is the narrative of charity, which is food insecurity and all these other wage inequalities and things will be resolved through charity. And the other narrative is this narrative of production, that what we're really facing, and this has been a trope that's been used for decades now, even longer, is that this is really just a production problem, and it's only going to get worse as with climate change and as the population expands. So how do we solve it? We really just have to, increase production and increase charity. Those two paradigms, when they come together here in the United States and elsewhere, has led to a lot of the problems that we're facing. And I think what the language and the framing does is it shifts the conversation entirely. You don't have a market, if you don't have a market-based approach, you need to have another strong normative framework like a rights-based approach. And the other thing that it does is it fundamentally shifts the question from not how do we feed the world or how do we feed hungry Americans, but how do we empower individuals and communities to be able to provide for themselves with dignity and with rights and sustainably? So for me, it's about shifting a consciousness and shifting the very moral center and values around how we think about and solve food.
So I think, the challenge now is how do we bring all these pieces together? But I'm going to start by that with just, do you think, and I think we have a diversity of opinions on this, is this all one field? I mean, is this, obviously we're talking about the things we put on our plate every day and what happened for it to get there, or why it's not there for some people. But do these sort of merit being studied as one field? And I don't know, actually, Peter, I might ask you to go first, and then we can respond to just why or why not are these all kind of part and parcel, or should they just be studied as separate issues?
Well, you've raised two questions,
But
Emily.
answer them both.
Okay, the first question is, are they related? And the answer is, of course they are. If you want to get food to the world that is nutritious and novel and uses scarce or available
Abundant,
resources that otherwise wouldn't be used, and solve labor problems in a fair way, that all relates to food. And it should be studied together. The problem is there's not enough time in any course that I've ever been involved in to do all of that. But you have to recognize in the real world, they're totally different. In the sense that the Food and Drug Administration does two things, and it does them unbelievably well. One is it makes sure the food is safe, which after all everything else depends on that. And the second is that it makes, to the best of its ability, sure that the food is labeled properly. Now, I put together the first nutrition labeling, and the thought that we had when we did that at FDA was that this was going to change everything. But you can't just put information out there and expect that somehow everybody's going to understand it. When I first introduced it and there was a press conference, I predicted it would take 3 generations for it to really be meaningful. I was optimistic. People still don't rely on it. They don't act on it. And I thought the other day of a wonderful professor of nutrition at Harvard who I heard give a couple of talks. This is 40 years ago. He was working in Africa, and he couldn't get the people in Africa to eat more nutritious food. And he realized people have habits. People, as he put it to me, don't eat for nutrition. They eat for pleasure. And so if you're going to change their nutritional status, you have to change the food. So he started putting the nutrition into the food to make it fortified with essential nutrients. Of course, the people who were eating it didn't even know it. But as a result, he changed the nutritional status of all of Africa. So you have to, just doing what FDA does is not enough, even if it does it is as well as can be done. Nutrition labeling did not prevent the worst epidemic of obesity in the United States history. It went into effect in 1971, and our country has gotten worse and worse and worse since then. So there's a limit to what government power can do.
Is it possible you caused the obesity epidemic?
I have worried about that. I have actually, in my course, I have asked the class a couple of times, am I the guilty party?
Others want to jump in on this? Is this all one field? Is FDA, and maybe it's FDA law stands alone and everything else is a field, or is there a reason to kind of suck the FDA into the rest of this?
Yeah, I mean, Peter, I think you just made a beautiful case for looking at food law and policy as a holistic field.
And I agree with that, Nate. You know that. It should be looked at holistically. I struggle to think of any person who could cover in a course everything that we've already heard.
I try very, very hard.
I know.
My students know because there's a lot of reading.
So yeah, I mean, I think there's a lot of excitement right now, and a lot of interest in looking at the food system in a holistic way, and maybe not everything can be included, but trying to bring in different factors like the environment, like labor, because I think there are kind of two pressures. One is there are activists that are working in the field, and they've identified food or food systems as a really important part of their communities, and issues that they want to push on. And also the second pressure, I think, is just reality. I mean, it's hard to work in food in an isolated manner. I do a lot of environmental work and work with a lot of environmentalists, and you can't just look at it, and they're all aware, even the most classical conservationist environmentalists, everyone's aware that you can't just look at it from a purely environmental perspective. In the continental United States, almost 2/3 of the land is agricultural land, right? And people live on that land, people work on that land, and what happens on that land affects the communities that live near there. And so one of the exciting things to me about this field is that not only does it look at so many aspects of our life, but it's also really exciting that it brings in a lot of different disciplines like economics. Social scientists are really active in the field, and statisticians.
I would say from an organizing point of view, but with the fellowship I was doing here at Harvard, I was consulting with food policy councils around the country, which for those that don't know what a food policy council is, it's groups of activists in their local community or states that come together because they all have a shared interest in changing the food system in the place they live. And I think to what I think both Peter and Nate are saying, there are a lot of expertise, and nobody can be experts in everything. But I think that coalition building and realizing that there's a humbling experience about coming in thinking you know everything, and there being somebody there who's an expert in a different part of the food system, and you get totally you're told to sit back down. You know, I think that's really beneficial, and especially in our current food system where somebody could come, somebody could come in with a labor rights background and say the biggest problem in our city, in our state, in our country right now is that our restaurant workers, that our farm workers aren't being treated fairly. This is what we should prioritize. And then you have nutritionists coming in and saying, no, we need to prioritize a soda tax. Like, soda is killing everybody. We need to do that first. And then having a third person come in who is like, I only want to work on urban agriculture. Like, this is what's going to save the food system. And having those people have a dialogue with each other and even compromise on their own issue, maybe do a priority building together and decide how they're going to go through those issues one by one. You build, I think, much more effective coalitions that are actually going to get stuff done rather than having all of these disjointed efforts going on. I mean, I will say I am new to local politics. I've only been in it for a year, but there are a lot of local politicians that are like, oh, I did something related to food. Check. Don't have to worry about that for another 5 years. And it's like, no. You did this food thing, but the food impacts so many things that to be strategic and to work together, I think you can get a lot more done. So I don't know if I'm arguing that it is a field or that it should be a comprehensive, but it should be.
I've never heard that said better.
Thanks, Peter.
I'd say to that point too, I think, also if all those people are competing and trying to get attention rather than working together, that can be to the detriment.
I think the only thing I would add, since I'm sort of the on-the-ground person here, we're out picking stuff. We're out on organic farms and stuff. I would say that it's very complicated. And that it's very easy. It's not that easy, but even if you come up with, like you said, the person passing a law or this, or coming up with, I would urge everyone who's doing this to actually get on the ground, harvest it then you will start to see the complexity of all sides of it, and that it really takes people working together who are like-minded, but there's no kind of like pass a rule or an answer to everything. And things are changing very fast. I mean, this year, in terms of the weather, is impacting farmers and food and all over, like, incredibly. And so people are having to come up with game plans behind game plans. So the execution of it, I feel, is what's really challenging. And that's where it's a lot of work, but I can't think of anything more impactful.
Well, actually, on that, as a follow-up to you, because I think you also see this piece from what you do, consumers, I mean, we're talking about this from a lot of angles, but one angle is just consumers and what they're willing to eat, not willing to eat, what they're wanting, what they're asking for. So what's
you were saying that, you could put labels and things, but if nobody buys it or it's too expensive or they just think it looks bad, so part of that's why I did cookbooks, right? It's because it's a cookbook. It's very mainstream. I did put in our DC and Emily's stuff into the food waste one in there. So if they read it several times, it'll start getting in their brain. But how do you make it fun and cool? And that's where sometimes working with a lot of innovative chefs that can come up with something that tastes delicious and looks delicious can be like something that people are inspired to do, because you can't really legislate your way into that. And there's been huge amounts of change of people wanting to eat more vegetables and plants and eat lighter. That's changing just by demand. Changing by demand what food companies are doing, I think.
So, and I think on that, from our vantage here in the clinic, watching the development of this field in our law school and other law schools. So I would love, I'll jump in too, but maybe Nate and Smita and Peter too, from teaching, your own courses in the different institutions you've now taught at, what do you see changing within academia trying to address this?
Nothing. Nothing. I haven't seen, you have your traditional agriculture courses, agriculture law courses. You have your traditional food law courses. You have labor law courses. You've got corporate organization courses. You've got everybody touches on it, but no one has tried to pull it together. And what FDA is interested in hasn't changed in 100 years. Safety and labeling. And they are so overwhelmed with our food and drug supply trying to just do what they can do that asking them to take on anything else, they would just throw up their hands and say, we don't have the resources. We don't have the people. We don't. and we also don't have a mandate.
Well, here's a question I have, because I'm not an academic, but they have these land grant agricultural universities, one for
Yes.
every state. So Cornell, since I've lived down around that area, Cornell and Rutgers. And I went to, I have a beautiful wild cranberry bog. And so I don't know anything about cranberries, but I want to save it. I don't want it to turn into some helicopter sprayed, cranberry bog. So I go to the Cranberry Growers Association. It's dying out in New Jersey because it's getting too hot down there, and it just really likes cool weather. And all of it's all the research and everything, it was very interesting for me being an outsider, is all based on, all these new drugs that come. It's all like fungicide, very like one-dimensional. These are all the drugs that came out, and the university is basically testing those drugs to see, now they're testing to see, oh, wait, that one that we've been using for 20 years that killed all the pollinators, or it did something to the bones and something, and it didn't come out, the studies, until like 20 years later when they saw the longer-term effects. So that also seems to be this completely separate component that isn't tying into these discussions, but these are the people that are teaching the regular farmers and stuff how to do things, and these are your choices. You can use drug A or you can use fungicide B, and that's all that they're told. They're not told anything else about all these issues we're talking about. It's like
But there's a reason that they've only got one to use, because there's a wonderful statute, the Federal Insecticide, Fungicide, and Rodenticide Act, and you have to get a license from EPA to apply a new drug or insecticide to a cranberry. And in order to do that, you have to invest about the same amount of money as you do to develop a new drug, a new human drug. So we have a regulatory mechanism that constrains what people can do.
I would argue perhaps a little less well-regulated on the pesticide, through FIFRA than the FDA does. So I agree with you. FDA actually, for the most part, does what they're supposed to do well. Perhaps with more resources, particularly on the labeling side, they could do better. But I would disagree with you, even though I love you, Peter, on the fact that there are at least attempts being made to incorporate a lot of these things into courses. So I'll respond, and maybe
You go describe them. Then.
Nate and Smita respond as well. This is sort of what we try. I try to do in my course, because the clinic, we're working on all of these issues. So our clients might be. Ona mentioned food policy councils, and that was a big part of her work in the clinic. And now I'll also point to my new clinic staff over here. So Katie, Alyssa, Laura, anyone else from the clinic here? But we're all working on these kinds of issues. So a group comes to us and says, I'll think of one example. We've been doing work the past few years in Pittsburgh with the Pittsburgh Food Policy Council. So the first question they had was, we want to have healthier food in our schools. We have this one central kitchen, and it's huge, and we can't figure out how to produce healthy things and get them out. And Ona actually worked on this, so you could fill in any gaps. So we went on this whole investigation around their school food and purchasing, what they wanted, what they were doing. Then they came back the next year and said, all right, thanks for that. That was great. Actually was very successful. The superintendent of schools incorporated it into the strategic planning for the school system. So that was a success. And now we're working with them on, they're trying to work with the local food safety agency, the Allegheny County Department of Health, to figure out, are there modifications that could be made to their local food safety rules, which we can go on forever about, also federalism in food safety and who's in charge of what. But are there modifications we can make so that small businesses can produce more food and get past the regulatory hurdles, so we can have more development of local businesses, small businesses, more responsiveness to our community. So we've had to be these jack of all trades in the clinic work, responding to all these different issues. And the best way to do that is to learn about them as much as possible as a set of issues. And I also will give a shout out to two of my RAs who are here, Jack and Nathaniel, who are also two of the heads of our Food Law Society and have been helping me do some research on the number of courses and clinics teaching what they are calling self-proclaimed food law and policy. Separate in many of these schools, like here, we have a food and drug law course. separate from our food law and policy course. And other schools have an agricultural law course separate from their food law and policy. So I'll give you a few data points on that because it's a good plug for the article, which will be coming out in January. It was submitted on Sunday, very late. So law school courses, so we looked in 2014, there were at the top 100 law schools, 20 of them had a course entitled Food Law and Policy. Again, we tracked them distinct from Food and Drug Law or Agricultural Law. So that was 20 4 years ago, or 3 years ago, and now there are 34 at the top, at the same 100 schools. So 150, over 150%, almost 150% growth in just 3 years in this set of 100 law schools. In terms of clinics, I mentioned before we had the first dedicated clinic. There's now 4 food law and policy dedicated clinics. And there was more than doubling of the number of clinics at law schools that have taken on food law matters and food policy matters, which is interesting because I actually don't know what every clinic does. I only know what they do enough of to advertise it as something that they do on their website. So there's now, there were 30 clinics at 23 schools in 2014. There are now 69 clinics at 48 schools that have, on their own website, they're proclaiming, we work on the following matters, and one of those is a matter that's a food system matter. Most of these are transactional or economic development clinics, a lot of human rights clinics, environmental clinics. So those are a couple of data points, but I think there is something, and in some ways, perhaps responding to the fact that, just looking at this from the FDA perspective leaves something out. I want to let Smita jump into, and then you.
I just want to make one thing clear. What you didn't study is, are they truly integrating the various things we're talking about, or are they looking at it from an agricultural or a labor or an environmental standpoint? I was responding to you about the integration, because what I don't see is the integration. I wish I did. Go ahead.
So I'm actually really excited about the way this field is opening up, not just in law schools, but in other academic institutions. And I think like many things, academia comes late to the party, and it starts in the streets, it starts in conversations, it starts in social movements, it starts in cafes, it starts in farms, and it starts in fields, and it's now trickling up to academia. And what is happening right now, I don't know that it needs to be a field that covers every single thing, but I do think it's a field that needs to be alive to the many different facets that inform food, including issues of accessibility, of justice, of health and environment. What makes food so powerful and what makes food so personal to so many of us is because it's a deeply personal area in which all of these things necessarily intersect, right? So it's its transformative potential that draws me to the field. It's the ability to look at things through so many lenses, through something as comforting and personal and powerful as food, that I think is exciting. And so should we then endeavor to cover every single thing? I don't think so, but it does feel like a miss then to have conversations about food without looking at structural racism in the food system, for example, or to even have movements about labeling, et cetera, or food safety, or conversations about artisanal food without realizing that who has access to that kind of food and who doesn't, and who was raised over to grow that food. There are levels and layers to this, and the food conversation is not a new conversation. Our systems of slavery, of colonialism, our current corporate captured food regime is a grandchild of our colonial food regime, and power and domination in food in terms of how it's made, who grows it, and who gets to eat it has been part of human history and society. We now have a moment where food is taking center stage as an area where everybody is paying attention from different vantage points. So certainly from my point of view, it's an incredible opportunity to also then shed light on these other issues, including environmental claims and health issues, because we will not solve the problems that we're talking about if we look at food in silos, right? And I think taking Ona's point also around community organizing and stopping for a moment and thinking, well, I'm here to talk about this, but I'm not going to pretend that that means that I'm able to talk about that, all the rest of it. And I think one of the areas where, what I love about the clinical programs that there's a client clinic model is that it allows for, when done well, the voices of those who are on the front lines of these struggles right now, and who are the ones who are suffering the health consequences, the environmental racism, the violence of the food, who cannot afford to put enough nutritious food on their plate. Their voices have to be in the center of both policy and academic conversations and discussions. So, and I think so for me, this feels like a beautiful, tremendous opening, but it's one that we really have to allow ourselves to open and also become uncomfortable with, to have those conversations that are important to have now. I wanted to also just take a moment to respond to the micronutrients in Africa point, because for me, there's also one of the ways in which the field is not so much transforming but getting dominated is a particular narrative that says, not just in food but otherwise, that technology is going to solve our problems. And the adding of micronutrients to seed or to food to fix a problem, a structural problem of power and dispossession in the global South or in communities here in the global North, technology is not going to solve that solution. And it's offered again and again in terms of GM and the patenting of seeds. And we have to be really careful about the ways in which certain narratives are used as solutions to problems, but that only end up engendering more of those problems. So I think that was for me, I just wanted to kind of bring that in as an example where I've seen that example. And Raj Patel writes about it and talks about it beautifully when he talks about, poverty, but with added vitamins and micronutrients. Yeah, so look him up as well.
Do you want to comment, Nate?
I thought that was beautifully said.
I know. I'm glad people are recording, because Smita always has these nuggets of words put together so perfectly.
Well, I have a slightly different viewpoint,
Yeah.
and I might as well put it out there. My feeling is human health comes first, and that I don't want to see people hungry and starving because we're giving them food that is non-nutritious. Namely, what their indigenous food is not what they ought to be eating. And
Why is that? Why do you mean their indigenous food is not what they should be eating?
the food at the local grocery store or wherever,
what
whatever they're
grows
getting,
naturally, right?
if they are hungry and if they're not getting enough vitamin D
Okay,
or
but hungry
whatever,
is different from nutrition, right? If you don't have enough, that's a hungry. But I have a question about
it
indigenous
encompasses
food
both.
that people evolved eating not being nutritious. Because they've actually found that indigenous food, if they don't have enough of it, that's an issue. But about indigenous food, I think that's a kind of interesting value judgment we are placing on other peoples, that their indigenous food is not nutritious enough.
To go back to what Smita was saying about power, I mean, I think there's more and more research demonstrating that if you really want to address the issues of hunger and malnutrition, you have to address the power imbalances. And so it's not so much a disagreement as to whether or not we need to address them, but how to do so, I think.
Yeah.
I have no difficulty with that. I worry about people who are suffering from poor nutrition.
I think and I think we could all agree that we want all of us, not just people who've been so dispossessed. And I worry about the food that I'm eating and that I'm feeding my young children, and what is the nutritional value of that food. So much of the industrial ag processing of our food has stripped the value of that food. And here I want to bring in other frameworks and ideas that are trying to not only restore real nutritional value in the food, so it goes back to food being medicine as opposed to food being poison, but that they're doing it in a way that also gets at some of these political concerns and as a political project. food sovereignty struggles led at the global level by Via Campesina, which is an incredible and the largest social movement in the world, is a movement of indigenous people, small-scale farmers, agricultural workers, and migrant laborers called Via Campesina. And they have really started to bring into the conversations the strategy of agroecology as a strategy not just of growing much more nutritious food, but doing it in a way that leaves our planet and lands and soil and water more resilient moving forward, but also as a political project because it disconnects the dependency of communities from the kinds of agricultural inputs that agribusiness are creating and putting into the marketplace to increase dependency on those inputs and grabbing land in order to have these monoculture monocropping environments, et cetera. I say that in the context of this conversation because because one of the best ways to ensure rights, agency, health is actually to put power back in communities to be able to grow healthful food in a way that also gives them much greater agency and over how their food systems are created and the ways in which we interact with Mother Earth and nature to create that food. Indigenous food systems have actually been when we talk about indigenous peoples, one of the most healthful, regenerative, restorative, and dignified ways of growing and eating food. And it's the erasure of that I think has led to this public health crisis that we're facing today, that we're all facing, but also that indigenous communities and others are facing as well. So food sovereignty is really about putting agency back in communities. Agroecology is the methodology that gets at cooling the planet, carbon sequestration, nutrition, and politics. And it's a much more profound, challenging road, but a necessary one, and not the shortcut that technology provides without sinking deeper into these other issues. So I just put that out there as a framework that I think is very powerful.
So this is getting interesting. A lot of disagreement. I'm going to let Ona jump in because everyone else got to be part of this disagreement, so you can disagree too.
Right.
And then I'm going to try to put a frame on all this, and then actually in a minute or two we're going to open it up to you, so you can pick out which of these pieces you want to follow up more on. But go ahead.
Sure. I'm not going to add to, well, maybe I'll add to the disagreement, but I wanted to give two examples because I think it's always helpful to have specifics, and we're talking a lot about global issues, which it's sometimes hard to wrap your brain around. And two things that actually I worked on here at the clinic that really brought this conversation into sharp perspective. One, Emily mentioned we do a lot of work with Navajo Nation. We've had a partnership with them for several years, and that was my project. It was my baby. It was the hardest thing to leave. And with the Navajo diet, a lot of what Navajo people in this country have very high rates of chronic disease right now, and a lot of what's causing that is there's high soda consumption. Actually, one of the foods that is one of the hottest debates about whether it's an indigenous food is a bread that they fry in sometimes lard or oil and use the bread to eat the other indigenous food. That bread came from a time when Navajo people were put on reservations by the federal government and only given flour and oil and salt and sugar to make anything, so they had to make this bread. So even the conversation about whether it's indigenous or not, or the federal government kind of imposed this food on them, and now it's one of the least healthy foods they eat. And working with them was such a great and humbling experience for me because it was really a conversation about, okay, well, you guys got us into this problem. The U.S. government got us into this problem. So how do you talk about law and policy as a way to help them regain their health and kind of undo a lot of the harm that was done by some kind of, maybe arguably well-meaning government interventions a long time ago. So how do you use the same tool that put them in this position in the first place to help rebuild their health? And then another project we worked on briefly, actually Nate and I worked on it together, was in Puerto Rico. And it was a similar conversation about indigenous tube vegetables they were eating, and federal government nutritionists actually came to Puerto Rico and told them to stop eating those, that they were really bad for them, and to instead buy the white pasta that was in these new supermarkets. And also, when SNAP came in, when food stamps came in, great program that helps low-income communities, But when it came in, you could only use it at the grocery stores. You couldn't use it at the market. So you couldn't use it to buy the indigenous foods. You could only use it to buy what the grocery stores were selling. Several decades later, here we are with also obesity and very increased chronic diseases in the populations that now eat mostly this American Western food. So I thought those were both interesting examples of how this is coming into play, and I think something as lawyers and as we talk to our clinical students a lot about kind of coming in with using policy as a tool, but then being deferential to your clients about how they actually want you to use that rather than kind of coming in with your cape on.
So I'll say, I want to say one thing, and then I'm really excited to hear what questions you have, and they can be what we talked about or other. I mean, the next question I would have asked would have been, there's 800 other topics in food right now that are interesting, hot topics that we haven't touched on. So you can feel free to ask about those, and we'll put somebody on the spot. But I think this has really been a good way for you to also see that it's not only that we're trying to pull together a lot of different fields when we talk about this, but that even amongst people who have shared goals and hopes, that there's so much tension. And I think this is something that's a real challenge within food, that we don't have necessarily good mechanisms to address some of those tensions. And part of it is because we have many different agencies doing their own thing. FDA is doing what FDA does. I think they're doing it well. USDA is doing what their thing is. I don't know if they're doing it as well. EPA probably the least well right now. So they're well. And then there's also not only that, but different levels of government. And so I think, going back to kind of the point Peter made at the beginning about this age-old debate about having one single food agency, I don't know if it would make it better, but I think certainly the fact that there's all these different agencies, and then as lawyers, a lot of people come at this from a discipline that was created with an agency kind of focus. It makes it challenging to figure out how to deal with some of these tensions at the advocate level, at the government level, at the teaching. I think in some ways we're the most freedom in the academic setting because I can teach whatever I want. I just have to teach it well so students will come back. So I think this was just a good example of some of that. And now I'd love questions from you, and I know who I'm going to call on if you don't ask any. So.